Hello everyone. Today I shall read the chapter The Palliative Care. This is the last chapter of the memoir The Valiant Warrior, His Smile a Radiance. The Palliative Care. Hippocrates had said a physician's role is to cure sometimes, treat often, and comfort always. Though the terminology palliative care, PC in short, has recently become quite popular, the concept is, however, not new. The word palliate is derived from the Latin word pallium, meaning cloak. That is an all-encompassing care which cloaks or protects the patient from the harshness of the distressful symptoms of the disease, whether cure is possible or not. The words hospitality, hotel, hospice, hostel, and hospital are also derived from the same Latin root hospes, meaning guest. Hospice care refers to the philosophy of care of the whole person and all that matters to him or her. Hospices are the places where hospice care is given. Earlier, the hospices were run by religious groups who cared for the ill pilgrims. The ill either recovered or died in the institutions. King Ashoka built such institutions which were similar to the modern hospices. The term hospice was first used to describe a place for the terminally ill in 1842 in Lyon in France. The first hospice in India, Hospice des Bassins de Richmond in Pondicherry, was founded in 1876. The modern hospice and palliative care movement is attributed to Dame Cicely Saunders in London. She is an Anglican nurse, physician, and social worker who explored ways to help the dying and terminally ill cancer patients to die in the most comfortable manner. In 1975, the Government of India initiated a national cancer control program with the provision for PC. In 1982, WHO developed a global program for cancer pain relief. In 1984, pain relief became one of the basic services at primary health centers, PHCs, and it was extensively practiced in Kerala. In 1994, the Indian Association of Palliative Care, IAPC, the umbrella organization, was registered as a national organization. Palliative care will soon be included in the MBBS curriculum, and MD courses in palliative medicine have been started in Tata Memorial Hospital, All India Institute of Medical Science, and Gujarat Cancer and Research Institute. In Assam, the Guwahati Pain and Palliative Care Society, under the stewardship of its founder secretary, Dr. Dinesh Chandra Goswami, was the first to render pain and palliative care in the northeastern part of India since 1999. Late Dr. Shankar Mazumdar, chief anesthesiologist at NF Railway Hospital Maligaon, was the patron of palliative care who volunteered to contribute for this noble cause. Dr. Sabitri Das, Dr. Kavindra Bhagavati, and Dr. Dipankar Dakwa have been rendering PC services at BBCI for decades. This service was also made available in Digboi, Hojai, and Rongya since a long time. Dr. Sanghamitra Bora, in association with Assam Cancer Care Foundation, has created a unique cancer grid for patient care. PC in Kachar Cancer Care Hospital, started by Dr. Iqbal Bahar, along with Padma Shri awardee Dr. Ravi Kannan, needs to be mentioned for their yeoman's service to every nook and corner of the area. Recently, Dr. Arun Deka has started invasive techniques of nerve blocks for pain relief in State Cancer Institute, Guwahati. Dr. Kalpajit Datta from GNRC and Dr. Tanma Mohanta, AMCH and Jorhat Pain and Palliative Care Society are also rendering very good service in PC. In 2018, I, along with Mrs. Usha Sharma, started the Pain and Palliative Department in KGMT Multi-Speciality Hospital, and my team also renders home care of the terminally ill. Young doctors like Dr. Priyanka Surana, Dr. Shantana Das, Dr. Hasina P.S. Saikia are also into palliative care. Dedicated nurses, social workers like Mr. Hori Prasad Bora, Mr. Torun Sonwal, and many young volunteers are rendering service to remote areas of Assam and have indulged in outreach programs. Panna Bharali, a breast cancer survivor, also known as Angelina Jolie of Assam, had fought cancer with positivity. Today she chose to be a part of the Palliative Care Initiative, Pratishruti Cancer and Palliative Care Society in Dibrugarh due to the support given by Dr. Gayatri Gogoi, pathologist and pioneer in cancer biology. Panna's motto is to help cancer patients fight the disease. Dipshikha Cancer Care Foundation in Assam is literally the light of happiness for cancer patients who lack adequate information about the treatment process. It is an NGO that is well on its way to revolutionize cancer care in the country. Mr. Debashish Sharma is the chairman and Dr. Mrinmoyi Borua is the secretary of the foundation. The Dipshikha Hospice at Mirza provides a serene ambience for the hospice care, and the Sacred Heart Hospice in Hastinapur 9 Mile, Guwahati also takes care of the terminally ill. PC has historically been considered as a service for cancer patients, but over time the realization has set in for the need of PC for patients with other chronic and incurable diseases and also for the geriatric age group. WHO defines palliative care as the active, total holistic care of the patient and their families by a multi-professional team when the patient's disease is no longer responsive to curative treatment. It states, palliative care is an approach that improves the quality of life of the patients and their families facing the problems associated with life-threatening illnesses through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems like physical, psychosocial, and spiritual. Why do we need palliative care? Due to lack of knowledge and access to essential pain relief, innumerable patients die undignified and have agonizing deaths. An estimated 34 million need PC in the country, but less than 1% has access to it. Nearly 6 lakh people are in need of palliative care in Assam. In the last stage of the disease, as the curative treatment fails, palliative care takes the upper hand and erases the age-old statement, "Nothing can be done," and paves the way to solace physically, emotionally, psychologically, spiritually, and financially. When can palliative care be started? The present concept is that palliative care can be rendered from pre-diagnosis stage to relieve pain and other distressing symptoms at diagnosis, during the therapies to relieve the suffering and improve the quality of life, at life closure, and when the patient is actively dying, at death, and finally during the bereavement period. Principles of palliative care. Palliative care provides a support system to help patients live as actively as possible until death and helps the family cope during the patient's illness and during their own bereavement, for which it uses a multidisciplinary approach. It affirms life and regards dying as a normal process. It intends neither to hasten nor postpone death. The palliative care provider must rule out the cause of pain, which may be disease related, treatment related, debility related, and due to comorbidities. Total pain, coined by Dame Cicely Saunders, is the term used when physical, psychosocial, and spiritual distress combine to affect the patient. Palliative care aims at relieving total pain. The three-step analgesic ladder formulated by WHO in 1986 is a useful guideline which provides pain control in 90% of the patients. Step 1, non-opioids plus minus adjuvants. Step 2, weak opioids plus minus step 1 plus minus adjuvants. Step 3, strong opioids plus minus step 1 plus minus adjuvants. It is one small poppy for man, one giant leap for cancer patients in pain. The palliative care physician uses narcotics like morphine, fentanyl as the last resort and nerve blocks for selected patients. Adjuvants and co-analgesics, antidepressants, anxiolytics, and sedatives add to the comfort of the patient. Non-pharmacological interventions like acupuncture, touch therapy, aromatherapy, expressive art therapy like music, dance, drama, relaxation, and psychological support are an adjunct to medication that points to the centrality of holistic patient-centered care. What is death? Death is inevitable. It is the final destination we all share. When death strikes a rich person, he or she cannot bribe death to go away. A beautiful lady cannot use her charm to be excused. A strong man cannot wrestle out of death. A wise person cannot defeat death in a debate. Each person's death is unique. Sometimes there may be several symptoms, or at other times no symptoms. Human body starts to frail as death approaches. In fact, providing care to the terminally ill and dying patient is very challenging. The dying knows that his death is imminent, so along with him or her, the near ones are equally affected emotionally and socially, and that needs to be taken care of. The palliative model does not equate death with defeat, but accepts death as a natural close of life and provides comfort care and improves the quality of life of the patient as he or she progresses to a state of decline and allows a dignified death. In 2014, Indian Society of Critical Care Medicine and Indian Association of Palliative Care have prepared guidelines for limiting futile treatment in the Indian critical care units. Death of a person is accompanied by a complex scenario of loss, bereavement, and grief for those left behind in the family. Kubler-Ross in 1970 described 5 stages of grief, that is denial, anger, bargaining, depression, and acceptance. There are physical, emotional, cognitive, and behavioral manifestations of grief like feeling of tightness in the chest, palpitation, oversensitivity to noise, sadness, sense of disbelief, sleep disturbance, social withdrawal, or engagement in overactivity. What is bereavement care? The palliative care team also provides bereavement care and gives counseling to family members to cope up with the loss. Family and friends must be a non-judgmental listener and encourage them to talk about the deceased, must realize that any act of bereavement is a reaction to a major loss. The World Hospice and Palliative Care Day is observed on the second Saturday of October every year. The theme in 2019 was My Care, My Right, and in 2020 it is My Care, My Comfort. Palliative care groups raise their voice globally to provide comfort care to the terminally ill with love, compassion, and empathy. So that is the end of the chapter, the palliative care, and hope you all like listening to the audio book of The Valiant Warrior, His Smile a Radiance. Hope everyone is inspired by Ruplu's courage and positivity to fight the dreaded disease, the killer disease cancer. Please do pass on his message to fight all odds with a smile and keep him alive through this memoir, The Valiant Warrior, His Smile a Radiance.